Hello everyone, welcome to Buddha Zen Wisdom. We accompany you every day. Old Lee just got discharged from the hospital a few days ago. Today the weather is nice, so he plans to invite a friend out for a walk. However, after just over half an hour of walking, he has to stop and rest. Watching his legs and feet becoming increasingly uncoordinated, he can't help but worry. After turning 70, the number of discomforts in the body will only increase. What will he do in the future? His friend feels that his current condition is already quite good. After all, which elderly person over 70 doesn't have some ailments? If one can overcome these health challenges, longevity may not be far off. Why do we say this? Hello everyone, welcome to Buddhism and Zen. If you are between 70 and 75 years old and do not have these three types of diseases, then congratulations. Longevity may be waiting for you ahead. If you think this video is good, please click subscribe and give Buddhism and Zen a thumbs up. Don't forget to share it with your friends. Thank you for your support. Some say that turning 70 is a tough hurdle. As one ages, the body faces many unexpected issues. Firstly, the most common issue is significant physical decline, leading to a strong sense of aging. Secondly, the incidence of cancer and chronic diseases will significantly increase. More and more elderly people live with illnesses in their later years. Additionally, as bodily functions further decline, the elderly may also face issues such as significant muscle loss and abnormal digestion and absorption. Therefore, the medical community has proposed the concept of multiple chronic conditions and the situations of the elderly who develop multiple chronic diseases after aging, such as having three high conditions: hypertension, hyperlipidemia, and diabetes. According to Dr. Jean Ding, Deputy Chief Physician of the Geriatric Department at Shiyuan Hospital of the Chinese Academy of Traditional Chinese Medicine, the proportion of elderly individuals aged 65 and above experiencing multiple chronic conditions globally ranges from 40% to 56%. The situation in the UK is even more severe, with nearly two-thirds of individuals over 65 suffering from multiple ailments, and the same goes for two-thirds of elderly individuals in the US. Multiple diseases mean the need for more treatment medications, thus the elderly also face the problem of polypharmacy. Reports indicate that an 80-year-old individual, due to suffering from multiple diseases, needed to take more than 24 types of medications concurrently. The coexistence of multiple diseases is not a good phenomenon, especially for the elderly, as it can easily lead to severe hazards. Dr. Jean added that under the influence of multiple diseases, overall health can rapidly deteriorate, possibly accompanied by disabilities or partial disabilities. Coupled with negative psychological effects such as self-rejection, this can further bring negative impacts to families. With increasing diseases, the complexity of the medications taken also escalates, making drug interactions and side effects unavoidable, which can affect treatment outcomes. Excessive medication can also impose a financial burden on patients. Additionally, many elderly individuals have poor memory. If they happen to live alone and are prescribed multiple medications, they are more likely to forget doses, resulting in ineffective treatment. After the age of 70, if you do not have these three diseases, then congratulations. Longevity is hopeful. A previous study published in the Chinese Journal of Epidemiology on the causes of early death among middle-aged and elderly people showed that among subjects over the age of 70, three diseases are prone to high incidence and are also common causes of death among the elderly. The first is cardiovascular disease. The incidence of cardiovascular disease is quite high among seniors over 70. With aging, vascular function inevitably declines. Blood vessels are like the pipeline system in a city. Over time and with use, their function gradually deteriorates. Bad habits can exacerbate this decline. For instance, long-term smoking can damage endothelial cells, leading to vascular contraction and spasms, increasing blood viscosity and promoting thrombosis. Excessive alcohol consumption can affect the liver's fat metabolism, leading to elevated blood lipids and consequently accelerating atherosclerosis. These bad habits, combined with the natural decline of blood vessels that comes with aging, make cardiovascular diseases like arteriosclerosis more likely. For elderly individuals with hypertension, hyperlipidemia, and diabetes, extra caution is warranted. Hypertension places more stress on the heart, which over time can lead to hypertrophy and heart failure. Hyperlipidemia can cause lipid components in the blood to deposit on blood vessel walls, forming plaques that narrow the vessels and affect blood flow. High blood sugar can damage endothelial cells, reducing the elasticity of blood vessel walls and increasing the risk of cardiovascular disease. Therefore, experts remind the elderly that if they have any of these three high conditions, they must strictly follow medical advice, take medications on time, and control key health indicators. This is not only to alleviate current symptoms but also to prevent further development of cardiovascular diseases. Maintaining stable daily habits is also crucial for preventing cardiovascular issues. Elderly individuals should quit smoking and drinking, as these two bad habits pose long-term and serious damage to the cardiovascular system. A regular sleep schedule is equally important. Sufficient sleep allows the body to rest and recover fully, helping to maintain normal cardiovascular function. Regular exercise is also one of the key measures to prevent cardiovascular diseases. Moderate exercise can enhance heart function, improve vascular elasticity, promote blood circulation, and reduce blood viscosity. For example, walking is a very suitable exercise for the elderly, as it can both exercise the body without placing excessive burdens on it. In terms of diet, the elderly must adhere to healthy dietary principles by reducing the intake of foods high in fat, cholesterol, salt, and sugar while increasing the intake of nutritious foods such as vegetables, fruits, whole grains, fish, and legumes. These foods are rich in vitamins, minerals, dietary fiber, and high-quality proteins, which help maintain cardiovascular health. For instance, the vitamin C and fiber in fruits and vegetables can lower cholesterol levels in the blood, preventing vascular hardening. The unsaturated fatty acids found in fish can lower blood lipids, protecting the heart, while the dietary fiber in whole grains can promote intestinal motility and reduce cholesterol absorption. If an elderly person experiences symptoms of dizziness, palpitations, or chest tightness associated with cardiovascular disease, they should seek medical attention promptly to avoid delaying treatment. Early diagnosis and treatment can effectively control the condition, improve quality of life, and extend lifespan. The second disease is cancer, which is another type of disease that is highly prevalent among the elderly after the age of 70. During this stage, many chronic diseases are also at high incidence, making the prevention and diagnosis of cancer more complex. On one hand, early signs of cancer may be confused with symptoms of other chronic diseases. For instance, lung cancer may manifest as cough and sputum, which are symptoms similar to those of chronic bronchitis, easily overlooked by the elderly. Gastric cancer might show signs such as loss of appetite and indigestion, which resemble symptoms of common gastrointestinal diseases. On the other hand, as individuals age, their bodily functions decline, leading to a slower response to abnormal symptoms. For example, pain or lumps in certain body parts may not receive enough attention from the elderly, resulting in a decreased rate of early cancer detection. Thus, regular screening for related cancer risks is crucial for individuals over the age of 70. Different types of cancer have different screening methods. For lung cancer, low-dose spiral CT scans of the chest can help detect pulmonary lesions early. For gastric cancer, endoscopic examinations can observe the condition inside the stomach. For colorectal cancer, colonoscopy can be used to screen for lesions in the intestines. For breast cancer, elderly women can undergo mammography or breast ultrasound to detect abnormalities in the breasts. Regularly conducting these screenings can catch cancer while it is still in the early stages, thus improving treatment success rates and extending lifespan. In addition to regular screenings, the elderly can also take some measures in daily life to prevent cancer. Maintaining a healthy lifestyle is key. quit smoking and drinking to avoid exposure to carcinogens, eat a reasonable diet with plenty of vegetables, fruits, whole grains, and legumes while reducing the intake of red and processed meats and high-fat foods. Moderate exercise can boost immunity and enhance the body's resistance to cancer cells. Maintaining a good mindset is also essential. Avoiding prolonged feelings of anxiety and depression can prevent negative emotions from impacting the immune system and increasing the risk of cancer. The third disease is respiratory system diseases. Respiratory system diseases are also common among the elderly after the age of 70, primarily caused by infections in the bronchial passages and lungs. The elderly typically have lower immune functions, making them more susceptible to bacterial and viral infections. During cold weather, if elderly individuals do not take precautions against the cold, they are prone to illnesses. For example, in winter, lower temperatures can dry out the mucous membranes of the respiratory tract, reduce resistance, and make them more susceptible to infections, leading to colds, bronchitis, pneumonia, and other respiratory diseases. To prevent respiratory system diseases, the elderly should pay attention to keeping warm, especially in cold seasons. They can appropriately increase their clothing and wear scarves, hats, and other warming items. Ensuring good air circulation indoors is also very important. Opening windows for ventilation can help improve indoor air quality and reduce the breeding of bacteria and viruses. Exercise can enhance the elderly's immunity and increase their resistance to pathogens. For instance, elderly individuals can choose to walk outside on pleasant days to breathe fresh air and exercise their lung functions. Additionally, elderly individuals should maintain good personal hygiene habits by washing their hands frequently and avoiding touching their mouths and noses to reduce the chances of pathogens entering the body. If symptoms such as coughing, phlegm, or fever appear, they should seek medical attention promptly to avoid delaying treatment. In summary, after the age of 70, if you do not have the three diseases of cardiovascular disease, cancer, and respiratory diseases, then congratulations. You have a promising future ahead. If you have any concerns about your health, please consult a doctor for tailored advice. Thank you for watching.